All right, thanks, Mike, and thanks everyone for coming to this talk. Oh yeah, it is bright up here. And thanks a lot to Jeff and Eleanor for organizing this session. So I'm going to give a talk as a user of CNU data, and just to give some examples of some of the studies that I've done in the past that have made use of multiple environmental data sets, and using, in particular, data sets that are available at CNU, just to give people an idea of the kinds of studies that are available now. So first up is a study that we actually published it a few years ago in 2015, so this predates CNU, but we use the same data sets that are currently available with CNU. And so what we wanted to do was investigate associations between cause-specific mortality and associations with fine particulate matter, ozone, and nitrogen dioxide individually, and then together in joint multi-pollutant models, and then also cumulatively, so the cumulative risk of exposure to all three of these pollutants. And we wanted to do this in a national study across the country. So we used the 1991 CanCheck study, Canadian Census Health and Environment Cohort, that many people are probably familiar with, but it's a national study with, I think we had 16 years of follow-up. And so the data sets that we used in this study were fine particulate matter from satellite-derived estimates prepared by Randall Martin and his team at Dalhousie, and then some ozone models that were prepared by Environment Canada, and then a land use regression model for NO2 prepared by Perry Heistad. So back in these old days, pre-CNU, I had to sort of call up Aaron and Randall at Dalhousie and say, hey, can we use your data? And then contact the guys at Environment Canada, hey, can I use your data? And contact Perry. And so now, through CNU, it's a little more streamlined. And so yeah, just pointing out all these data are available for CNU and nationally, so it allows for national level analyses. So I'm not going to go into depth about the project. This is I'm just touching on these studies. So I'm just showing here, these are results for non-accidental mortality from fully adjusted models, and you see there's some of these are for individual pollutants and multi-pollutants. So these models are adjusted for many personal level covariates and a number of different neighborhood contextual characteristics, as well as the different pollutants. And so in the case of, like, say, the one on the far right there, NO2 adjusted for the other two pollutants, you can sort of think of that as the marginal effect of NO2 when you're controlling for those other two exposures, other two pollutants. Whereas here I'm showing cumulative risk estimates. And so these are essentially a product of the three effects. And so the way these can be interpreted, well, the one on the far right there, that's PM2.5 plus ozone and NO2, is the increased risk associated with a 1 unit increase in all three pollutants versus no increase in any of the pollutants. So anyway, I'm just touching on this study, but I just wanted to point out that this allowed us to bring in together the three pollutants together in a really cool study, and we were able to sort of demonstrate that looking at PM2.5 alone wasn't really enough to characterize the toxic mixture of the ambient concentrations across Canada. So this is another study that was published last fall. I also used, well, the last study was the 1991 CanCheck. This was with the 2001 CanCheck, so that's the respondents to the 2001 census. And here I wanted to look at associations between residential greenness and cause-specific mortality. And in this case, I restricted the study to urban Canadians. So this was restricted to people living in the 30 biggest cities in Canada. And you can see the sample size there is almost 1.5 million people, so it's a really big study. And our main estimate of exposure was NDVI, so this is a normalized difference vegetation index. It's a satellite-derived measure of the presence of green vegetation on the ground. This study also predated CNU, so I had to compile these and assign them to the postal codes myself, but now Evan and the team have assigned multiple different measures of greenness at different buffer sizes and so on that are available. And I also controlled my models for, or adjusted the models for potential confounding by those same other pollutants that I mentioned in the previous study. So once again, all these data that we used in this study are now available through CNU. So again, I'm not going to go into all the details of the study. These are just some of the results that I think are among the more interesting ones. So at the top there among all subjects, this is the hazard ratio in our fully adjusted model for non-accidental mortality. And you can see we found very strong protective effects. So a reduced risk of mortality of about 8% with each interquartile increase in the amount of greenness around where these people were living in a really well adjusted model. And then just found some really interesting effect modifications. So you see that we found substantially stronger effects among men compared to women. And then we found kind of the classic socioeconomic gradient in health, such that at each increased increment of education and income quintile, we found more protective effects, such that among people in the lowest income quintile, there was essentially no benefit of the exposure to the greenness. It doesn't want to go. There we go. So third up, this is a study that's just underway right now. This is some work being led by my postdoc, Sandra McGallies at University of New Brunswick. And we're not using CanCheck. And what she wants to do is explore associations between air pollution and multiple sclerosis, multiple sclerosis hospitalizations, multiple sclerosis incidence and prevalence, and associations with air pollution there. So here, the patients are identified through the CCDSS, the Canadian Chronic Disease Surveillance System, and hospital admissions are identified through hospital discharge abstracts. So these provide dates of diagnoses as well as residential postal codes, which will allow us to link with the environmental data sets and for tracking people's residential locations over time. And so we've got a big list of a number of different data sets that she's requested through CNU. I think Evan said the average was 7. I don't know if air pollution, if that counts as 4 or 5 there, if that's 1, but she requested a lot. And so her main exposures of interest are the air pollution variables. She's also acquired as Evan mentioned, the material and social deprivation indices. So as I said, we're working with administrative data sets. We don't have any personal level income or education or any kind of socioeconomic position data. So we'll use these in place to describe neighborhood and community characteristics where people live. We also got the satellite-derived nighttime light. However, if anyone was at the talk I was at 2 days ago, it looked like there was zero correlation between the satellite-derived outdoor night at light and measurements taken inside the bedroom. So I'm not too sure what we'll do with those at this point. And then some weather indicators. So there's evidence from other studies that weather conditions, including amount of precipitation and temperature, can be associated with multiple sclerosis. So this is work that's ongoing. But just trying to highlight multi-factor, multi-pollutant, multi-exposures data sets that can all be sort of brought together for some really cool analyses. So just here's some of my perspectives as someone who's now using these data. For me, it's been a huge time saver to be able to access these data. As I mentioned in those earlier studies, I had to do all that exposure assignment myself, and it's not a struggle, but it's tricky to make sure you're using the exact same exposure method, every time, and so it's very, I guess, great that knowing that these data are assigned using a consistent method. So it allows me to have internal consistency between my ongoing studies, knowing that the data have been assigned the same way, and also consistent between other people's studies for the purposes of comparing. And also, in my opinion, they've got really great documentation, so it really facilitates writing up the methods section of your paper. They sort of document the limitations and the just considerations of how the data were collected, so that facilitates writing up the data. And then, so their key unit, the default unit of spatial aggregation is the postal code. That's what they've assigned all their data sets to. And so 99% of the time, or I don't know, maybe 90% of the time, that's excellent. That's probably what people want. But if you are interested in something like the mean level of greenness in a school catchment area, or within a census division, which is like a county, or the mean level of air pollution in some kind of aerial unit that isn't the postal code, that's something that you sort of have to negotiate with them as a possible custom job, which is totally doable. And then this brings me to one of my favorite trippy photos from the internet. With the postal code for doing research in Canada, the world becomes your oyster. basically, all of our major cohorts have postal code data, so the CanCheck, Canadian Community Health Survey, the CHMS, the Longitudinal Study on Aging, all of these data sets have postal codes, so can be very readily linked, and in some cases have already been linked to a number of these environmental data sets. Also, administrative data, if you're working with administrative data like discharge abstracts or data from cancer registries, those all have postal codes and so can be readily linked. And then also, facilities, if you're looking at, if you want to do some kind of study on schools or hospitals, of course they're going to have a residential postal, or not a resident, they will have a locational postal code so that you can link them up with different environmental data sets. And that's all I have.